Hello, I'm Dr. Mike, and today we're diving deep into understanding bowel cancer. It's a topic that can be daunting, but knowledge is power. It's crucial to be informed about this condition, its symptoms, risks, and the available treatments. By understanding bowel cancer, we can empower ourselves to take charge of our health and make informed decisions. Throughout this video, we'll break down complex medical terms into easy-to-understand language, ensuring everyone can benefit from this information. Let's get started. So, what exactly is bowel cancer? In simple terms, it's a type of cancer that originates in the large intestine, which is the last part of your digestive tract. The most common types are colon cancer and rectal cancer, depending on where they start. Now, this journey begins when cells in the lining of the bowel start growing abnormally. Over time, these abnormal cells can form a mass of tissue known as a tumor. This tumor can be benign, meaning it's not cancerous, or malignant, meaning it is cancerous and can spread to other parts of the body. Early detection is key when it comes to bowel cancer. That's why it's so important to be aware of the symptoms. Some common signs include a persistent change in your bowel habits, such as diarrhea, constipation, or a feeling that your bowel doesn't empty completely. You might also experience blood in your stool, abdominal pain, bloating, weight loss for no apparent reason, and extreme tiredness. Now, I know some of these symptoms can be caused by other less serious conditions, but it's always best to err on the side of caution. Now, let's talk about the risk factors and causes of bowel cancer. Some factors are beyond our control, like age. The risk increases as we get older, especially after 50. Family history also plays a role. Having a close relative with bowel cancer increases your risk. Certain inherited conditions like Lynch syndrome can significantly elevate the risk. But here's the good news. Many risk factors are modifiable. If you experience any symptoms that concern you, don't hesitate to talk to your doctor. They'll ask about your medical history and may recommend some tests. One of the most common diagnostic tools is a colonoscopy. It might sound intimidating, but it's a very effective procedure. During a colonoscopy, a thin, flexible tube with a camera is inserted into the rectum to examine the entire colon. This allows doctors to visualize the lining of the bowel, detect any abnormalities, and even remove polyps, which are small growths that can sometimes develop into cancer. If bowel cancer is diagnosed, it's important to understand the stage, type, and grade of the cancer. These factors help determine the best course of treatment and provide insights into the prognosis. Staging describes the extent of the cancer from stage 0, where it's localized to the inner lining of the bowel, to stage 4, where it has spread to distant organs. The type of bowel cancer refers to the specific cells where the cancer originated, while the grade describes how abnormal the cancer cells look under a microscope, indicating how quickly they might grow and spread. The good news is that bowel cancer is highly treatable, especially when detected early. Treatment options vary depending on the stage, type, and grade of the cancer, as well as the patient's overall health. Surgery is a common treatment, especially in earlier stages where the tumor can be surgically removed. Chemotherapy, which uses drugs to kill cancer cells, may be recommended after surgery to destroy any remaining cancer cells or to shrink tumors before surgery. Radiation therapy, which uses high-energy rays to target and destroy cancer cells, is another option. The survival rate for bowel cancer has been steadily increasing, thanks to advancements in treatment and early detection. The 5-year survival rate, which represents the percentage of people who live at least 5 years after diagnosis, varies depending on the stage at diagnosis. For example, if the cancer is detected early, when it's localized, the 5-year survival rate is quite high. However, if the cancer has spread to distant organs, the survival rate decreases. The field of oncology is constantly evolving, with ongoing research and clinical trials leading to new and improved treatments for bowel cancer. Researchers are working tirelessly to develop targeted therapies that attack cancer cells more precisely, minimizing damage to healthy cells. Immunotherapy, which harnesses the body's own immune system to fight cancer, is showing great promise. Clinical trials play a crucial role in advancing cancer treatment. They allow researchers to test the safety and effectiveness of new drugs and therapies in humans. Advanced bowel cancer means that the cancer has spread beyond the bowel to other parts of the body, such as the liver, lungs, or lymph nodes. While this news can be overwhelming, it's important to remember that there are still treatment options available. Chemotherapy, radiation therapy, and targeted therapies can help control the spread of the cancer and alleviate symptoms. Palliative care, which focuses on providing relief from symptoms and improving quality of life, is also an essential aspect of managing advanced bowel cancer. A cancer diagnosis can impact every aspect of life, but there are ways to navigate the challenges and maintain a good quality of life. Eating a healthy diet, engaging in regular physical activity, and getting enough sleep can help support your overall health and well-being. It's also crucial to manage stress and seek emotional support. Talking to a therapist or joining a support group can provide a safe space to share your feelings and connect with others who understand what you're going through. Bowel cancer is a serious condition, but with awareness, early detection, and advancements in treatment, there is hope. Remember, knowledge is power. By understanding bowel cancer, we can take proactive steps to protect our health. If you or someone you know is experiencing symptoms or has concerns about bowel cancer, please consult a healthcare professional. They can provide personalized guidance and support. Thank you for watching, and take care of your health.